Welcome back to another edition of the Hart2Heart Podcast. And my guest today is Dr. Ashley Winter. She's a urologist based out of Los Angeles, California. So, Dr. Winter, welcome to the show.
Hi, thank you so much for having me.
Yeah, so I really wanted to have you on. You know, it's quite interesting actually being, I think, a female urologist even in itself. It's probably very, very interesting. Why don't we start there? Like, how did you choose urology when you were doing your residency?
Yeah, interesting question, or not that interesting question. I actually decided to go to med school to become a urologist. I have no doctors in my family. I didn't. I come from a long line of engineers, and I was in engineering school, and I just decided it was cool to study, but I didn't want to do it for the rest of my life. And I was trying to figure out what to do. And a family member went to a urologist for an issue they had and came home and described the urology appointment. I was like, that sounds really interesting. I'll just go become a urologist, which is the most random thing. I'd love to say that it was a really dramatic or inspirational story, but then I applied to med school and I learned about the other specialties, and there was nothing else I thought was remotely as cool. I just loved it. I don't know, urologists are funny people. They didn't take themselves too seriously. They made all the bathroom humor, and you don't
be around.
Cool people to be around. Yeah. They just had fun, and they were cool, and they were hands-on, and they did surgery, but they also had relationships with patients, and you kind of deal with a lot of taboo topics. And I also like to say, there are so many doctors saving lives, and I just that's so intense. And I kind of just wanted to make people's lives better. And that's part of the reason I focused on sexual healthcare and men and women's sexual health and hormonal health. 'Cause I'm there's a person who can keep you alive, and they're the heavy, hardcore, heavy duty doctor, who's going to do your transplant surgery or your trauma surgery or brain surgery or your cardiologist. I'm just help you with your sex life. That's my style.
Good. Hey,
keep it light.
People need help with their sex life.
Exactly.
I bet there's a lot of people that are listening to this just for that, just because they need help with their sex life. And so, we need people like you out there. And obviously, even with divorce rates and stuff like that, how much of that does sometimes, surround intimacy, and intimacy issues. So, I think that there's a lot to be said to what you're doing,
A huge component of divorces have to do with intimacy, and people not understanding that issues with intimacy are not always a relationship problem. And sometimes they're a health problem. They are a physical thing happening with your body, and people let it come between them instead of talking about it or getting help for it or explaining it to their partner. And that's part of the reason to educate, demystify, talk about this stuff so people don't suffer like that and let it affect their relationships.
Yeah, for sure. I mean, we'll get into it later, but just, one quick note on that, ED, for example, could, be an issue with a vascular issue. You don't know what's really, going on. A lot of things could be happening there. But one question I do want to ask you is, we hear a lot about testosterone now these days, but what is the age where, men should be getting their testosterone checked? Is there a specific age, or should it be just by symptoms? Or what is your overall recommendations for a man getting their testosterone checked for the first time?
Yeah, great question. So I think if you, let's say, have no list of medical problems and you're just a dude walking around, you're not taking any medications, healthy, clean bill of health, you had your annual with your doctor, blah, 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 all the labs are good. I don't think there's any specific age at which you need to check. I think if you go by symptoms then, right? And the symptoms can be really broad. If you're experiencing fatigue, if you're experiencing low libido, if you're experiencing erectile dysfunction, if you feel like you have reduced, exercise tolerance or gains at the gym, right? All these things could be a reason to check a testosterone, but I don't think there's a specific age. Conversely, there are certain groups of people where I just think everybody should get checked for testosterone. So, for example, if you have diabetes is associated with low testosterone. Obesity, right? Being overweight, associated with low testosterone. So there are certain conditions that just have such a high relationship to having a low testosterone that I think those populations, even if you're 25, get a testosterone check, just in my opinion. And sometimes addressing that low testosterone can actually help reverse the disease process, right? So this is something like that comes up a lot now with so many people on these GLP-1 agonist medications like Ozempic, right? For weight loss. And it's this chicken or egg phenomenon because people who are overweight very often have low testosterone, right? And so the question is, like, if they lose the weight, then their testosterone might go up. But conversely, if you treat their low testosterone, they may just lose weight. And so which is the better approach, right? And some people say, well, we'll treat both. I think it definitely should be individualized, and you should keep this at the forefront of your mind. And every single time you're prescribing a GLP-1 medication to somebody, man or woman, to be frank, we should be looking at their testosterone, because there are some people who are overweight. They also have low libido, have erectile dysfunction. And for them, maybe saying, hey, let's see where you get with just the testosterone, they might end up in a better place than where they would with the GLP-1. And the GLP-1 is a very expensive medication, or at least in the United States. I don't know how the costs are of those in the...
Yeah, no, that's very, very interesting, because I think that, a lot of men, they don't have the motivation sometimes to exercise, and sometimes they don't have the confidence either. And, by giving someone a little bit of testosterone, well, first of all, testosterone can help burn fat in and of itself, and obviously it can help build muscle. But I'm also talking about the cognitive benefits and the neuro benefits and the motivation benefits, because one thing, I'm not sure if it's testosterone, if it's DHT, but one of the two, you can correct me on this, it makes exercise feel good. I think that's right. Or it makes hard work feel better. You can tolerate it better. Maybe it just has to do with the pain tolerance effect of testosterone. But either way, it really, really drives up motivation for sure. And like I said, it also has the ability to decrease body fat and add muscle, which is, what you're trying to do when someone's, overweight too, is you don't just want to have them lose weight where it's half muscle and half fat. And we won't get into too much of the GLP-1s, but there is some evidence they may contribute more to that. But I do think that you could, mitigate that just by strength training and eating a high protein diet. But some people believe that there's a slightly more muscle loss to fat loss ratio with Ozempic than if you don't use it. But very, very good point about, about people with obesity and people struggling with weight, needing to get their testosterone levels checked. And even too with people with depression, big time. I think that's, highly linked to, low testosterone. And there's several studies that show that when you, give testosterone to someone who has low testosterone, they have, significant benefits in their psychiatric conditions and then in their overall mood and behavior.
Yeah, 100%. I mean, there are people who say, and I'm not talking about somebody who has a normal testosterone taking testosterone, right? That's not part of my practice. I don't advocate for that. But somebody who has, truly a low testosterone coming in, having received testosterone, and saying I feel like my brain is screwed back on for the first time. There's some light there, there's some spark there, there's something there that wasn't there, right? And again, I want to circle back to say I am 100% think that those GLP-1 medications are amazing medications. More so just that we should all keep in the forefront of our mind as medical weight loss has become a huge topic, that thinking about something like testosterone, that should not get lost in the shuffle. That needs to be just as much a part of this conversation as it ever was, because it's a hugely powerful tool and piece of the puzzle.
I agree.
But yeah.
So, One thing that I wanted to ask you about today. So part of this was because Dr. Reno Malik was on Andrew Hooverman, and they were talking a lot about pelvic floor physio. And so, when should men get their pelvic floor checked, and like what signs and symptoms should they be looking out for? And I don't know if I've mentioned this on this podcast before, but just very quick story. After I heard that podcast, for the very first time, I was like, I just want to get this checked out just to make sure. Like, I don't feel like I have any like symptoms here, although I do pee a lot at night, but I feel like every guy pees a lot at night. We'll chat about that maybe a little bit too. And then, anyways, it's not a comfortable exam. Like, I did not like it. I mean, she's going right up your ass. Like when
You
she's
saw
like,
a physical therapist?
yeah, to do a pelvic floor physio, to do a check. And I was good, which was great. She was like, yeah, you don't need to do anything. Your muscles are fine there. And, but anyways, like, when should people get their pelvic floor checked, and what signs and symptoms, like, should they be looking for?
Yeah. So, just well, first off, I know Dr. Reno Malik really well. She's also a urologist, and she also is in Southern California. She even went to like my daughter's first birthday party. But we've known each other for a long time, and the community of urologists is small, so we know each other. And she's great. And to explain to people who are listening, right, the pelvic floor is this set of muscles that surround your pelvic organs, prevent them from falling out of your pelvis, but also provide some key functions in your body, right? So like, for example, orgasm and ejaculation are deeply tied to rhythmic contractions of muscles in your pelvic floor, right? And so there's associated pleasure with those muscles and function. So it's very complex, very important, very overlooked. My opinion is that nobody needs to just go in and get like a blanket check of it. I mean, I'm glad you did that in the name of science, I guess. But like, the regular dude walking around or woman not having problems, like, you don't need to do that, right? Like, it's not going to detect cancer or something like that. There's no like screening benefit. But if you are having any symptoms like, and you're talking about like frequent urination despite not drinking a lot of fluid, or urgency to go to the bathroom, or pain, like people sometimes think that they have prostatitis, right? Like infection or inflammation in their prostate gland, but their urine tests and their tests for infection are negative, right? Like pain perceived as pain in their prostate can actually be from the muscles sitting around the prostate. Pain after orgasm or ejaculation, erectile dysfunction. All of these functions are related to the muscles. And those, when you're having those symptoms, I always think it's a phenomenal idea to go see pelvic floor physical therapy. And they can be like, hey, no, there's no musculoskeletal component to your problem, but there might be. And let's say you have like a really high tone pelvic floor, and that is actually why you feel like you need to pee all the time, because every time your bladder fills with any urine, those muscles start overfiring, right? Them teaching you how to relax that might prevent you from ending up on a medication that you would otherwise be on for the rest of your life, right? So it's like, if there is something you can address with relaxation, internal work, exercises that you can avoid being on a prescription, like, why would you not want to do that, right? So if you have the symptoms, it's a great part of your care. The main issue is just access. Like, there's not a ton of people who specialize in pelvic floor physical therapy, and even less so that do men, right?
And not a lot of men probably wouldn't want to go get it checked either. Like, it's not really like what a lot of guys really want to do, but it does seem to be, like you said, like some of your patients have, had some of those symptoms, whether it's like, peeing too much or erectile dysfunction, and they've gone to pelvic floor physio and had some success in reversing those conditions, or at least helping them.
Yes, incredibly so, right? So let's give you like a small example, right? Like in the case of erectile dysfunction, so there's a muscle that sits around the base of your penis on the underside, right? And this is called the bulbocavernosus muscle or the bulbospongiosus muscles. There's two components to that, right? And the bulbocavernosus and the bulbospongiosus muscles are literally like nature's Cochrane. Like they help you. So right before, and you may notice this, most guys will probably notice this, right before you orgasm, your erection gets a lot harder, right? It goes from like hard to like really, really hard. And a big part of that is like this muscle contracting and tensing you up and helping you get like that peak hardness, okay? And then the contractions of that muscle then have to do with orgasm and pleasure, right? So
when it's at the very peak, then is it sympathetic? Like that very end is sympathetic when you're like when you're blowing your load, right? Or when you're ejaculating.
Yeah. Like point and shoot, right? Parasympathetic,
right.
Sympathetic.
Yeah. So like that last little sympathetic is what gets it like the extra firmness at the very, very end. Is that correct?
That and right. And this like muscle contraction, right? Like, and so the pelvic floor physical therapist can be like, teach you about your body, show you where that muscle is, like help you do exercises to strengthen those muscles. And that can actually improve your sexual pleasure and your performance, right? Without any drug or supplement or lab testing or anything. And this is like something very under-recognized by people, but it's not just all directly in the penis itself. It's like the muscles in your pelvis help you get extra hard and they help you have pleasure and they help you get an orgasm. And that's like something you can optimize.
and so how would someone, like, say if you don't have any issues, but you want to like optimize this, like what do you recommend to do to like optimize this?
Yeah, that's a good question. I mean, you could probably like, if you look up in your area, pelvic health therapists that are specializing in sexual health and men's health, I mean, you can certainly make an appointment and be like, I want to learn all the right exercises to like optimize my erections and my orgasm. And like, if they're a serious physio in that space, that's something they can teach you about. And they probably don't have to like stick their finger up your butt to do that either, right? Like they can just teach you about how to do it without assessing, because you're not assessing for pain or anything. You're teaching about the anatomy, teaching about the exercises. You don't have to be like, putting a finger, on your levator muscles to do that.
I think you should make a YouTube video of all the exercises that can optimize pelvic floor.
Yeah. I mean, maybe. I mean, and this is like, there probably are videos about that online. Like, what are the exercises you can do to make yourself have the best peak erection, And again, I'm not talking about like throughout the whole time, but like that extra, like getting over the hump, that extra like icing on the top, like that's going to be, right? If you have no erections whatsoever, like the exercises aren't going to do the job, right? But this is like some extra help there.
Okay. No, I like that. Not to switch to a sad topic, but what did you think about that study that I sent you, I think yesterday? I'm not sure if you had a chance to look at it, but about the patients in their teens and 20s, and there was like this 31 times increase in basically males in their teens and 20s, like presenting for ED. Again, like, 31 times, you got to look at the study and be like, okay, there's something like maybe a little bit off there, but
really intense number. Yeah.
And then, but, is something going on? Like, do you feel like do you find that there's people being referred to you or people coming to you, like who are younger and younger with ED? And is it mostly due to like psychogenic reasons? Is it due to pornography? Is this something that you're seeing in your practice?
Yeah. I mean, in my prior job, I definitely saw younger, like more kind of late teens type of patients, now less so. And that was just because I worked in a large health system, and like, a lot of the pediatricians and pediatric urologists were like, I don't really like do erectile dysfunction. So like, can you see these patients? So I would. I think there's some component to the increasing rates of erectile dysfunction. I don't think it's 31 times. I think that's like really intense number. Like I would have to, I looked at the paper briefly. I didn't look at like the methods in depth. So I can't comment 100%, but right, there's some trueness to the increasing rate of erectile dysfunction, in part due to higher rates of things like obesity and diabetes. And, those things can start affecting your penis from a very young age. That's not 31 times, right? And definitely, if somebody is having like risk factors like diabetes, obesity, eating a very unhealthy diet, like these are things to counsel them as having a relationship to their penis at any age. And the youngest men I see with complete loss of penile function, like no erections, no ejaculation, minimal sensation of their penis, are generally people who are like type 1 diabetics from a young age, had a very high A1C, right? So high blood sugar levels for a really long time. And I say to them, do you understand that like the nerve damage from your diabetes caused your penis to stop working? And they're like, nobody ever told me that, right? Like nobody told me that when I was going through puberty, when I was old, when I was in my 20s, and now they're 32 years old and there's nothing going on. Okay.
And they would have been so motivated. If you told them that they were going to have a heart attack, they wouldn't have cared. But if you told them that if you kept going this way, your penis is not going to work, they would have cared so much.
They would have cared so much. It's true. So, there's this thinking like if somebody is 17, 18, 19 years old and they come in your office and they have erectile dysfunction, that it's stress or performance anxiety or porn. And those are all valid components. But you really, really have to take the physical aspect of it seriously and at least do the education so that they don't end up in that position where they're in a urologist's office at the age of 32 and there's nothing going on, right? Because they're going to be devastated and it's such a missed opportunity. So there's definitely that component. I'm not like an expert on pornography. Certainly I think there's some component of like people comparing themselves to unrealistic standards that happens with, exposure to internet pornography, that happens just with social media in general. That causes people to get in their head somewhat about sex, right? I mean, like our parents' generation, I think they had no idea what was like, what nobody told them anything about sex. And that wasn't great either. But then to some extent, they didn't have any standard that they felt like they had to perform to, right? So, I think when those young people come in my office, I have a few boxes I check, right? Like, do they have any risk factors for real physical erectile dysfunction? Yes, we talk about porn. Yes, we talk about standards. We talk about performance anxiety. And once we've checked those boxes and we make sure there's no blood work we need to do, like maybe we do a testosterone, maybe we check an A1C, right? We screen them for diabetes. Then we do talk about things like Viagra or Cialis. I don't think even people in their late teens are too young for that because it can help with performance anxiety associated erectile dysfunction. And then they get confidence and they can taper it off and stop it.
And that's exactly what that study said. They said that, the best way to treat these people, because I wanted to know too, because, sometimes when guys come in and are this young, like I don't really feel very comfortable giving them something like that, and I haven't in the past. I mean, I may feel a little bit more comfortable now, particularly if they, keep coming back and back and it's really affecting, their psychological health and well-being. I can see how, trying with 5 and now even have 2.5 milligrams of Cialis, we're talking about. Cialis is just like Viagra, except it lasts a little bit longer for people who don't know what it is. And so, you can get in 5 milligrams and now in 2.5 milligrams. So you could easily, start them on 5 and then wean them to 2.5 and then potentially, wean them off, completely, because you got to do something with them. You can't really just tell them like, it's all in your head, go home. And then it happens again. And then, I mean, I imagine it would be really difficult to have that issue as an 18-year-old, just because, hard to recover from if you don't perform well, kind of thing, so, I was happy to see that, at least, again, I don't like giving it out, but if it's the best treatment for a particular person, then it's the best treatment for a particular person. And that's kind of what we should stick to, obviously. But just talking too about Cialis and mental health, like, again, there was like studies have indicated that like people who, have erectile dysfunction and you give them like daily Cialis or give them Cialis even as needed, like their well-being like improves like so much. So maybe you could just speak a little bit about like, not just how, Cialis is effective for treating erectile dysfunction, but maybe just the overall impact it can have on someone's life, maybe their relationships and that kind of thing.
Yeah. And a few things, just to circle back a little bit about what you're talking about before.
Sure.
Part of the reason I have no problem prescribing Cialis or Viagra to younger people is because, the big fear with those medications is something called priapism. So for people listening, right, it's the worry that you're going to have an erection that doesn't go down, that lands you in the emergency room. Maybe you've heard the ads, like if you have an erection lasting longer than 4 hours, call your doctor, blah, blah, blah. That is not based on any data. So those medications do not cause that. They just don't. It's like a myth. They had to put that in their advertising, but none of the data on the clinical trials for PDE5 inhibitors indicates that those medications cause people to have an erection that won't go down, right? They're extremely safe. They also don't cause a spontaneous erection, meaning like what I tell the people, right? If you're sitting at home working on your income taxes, or I don't know how taxes work in Canada, but doing some really boring paperwork at home, like, and you take a Viagra, nothing's going to happen, right? Like you're not just going to be sitting there and getting an erection. These medications enhance the pro-erection signals when you have them there, right? So it's like an amp, right? It's like if you're not putting any sound input into your amp, it's not going to amplify it. So these are such important things to know. So there's so little downside, and they don't cause a dependence, meaning it's not like if you took one and then didn't take one the next day, it's not going to affect your baseline sexual performance. And all of these are reasons why it's really safe and basically fine to give it to young people. And again, like you're saying, you're going to end that cycle of them getting the performance anxiety response. And then they can wean it off, no problem. And there's really like basically no risk from it, right? You're not going to give them something that they're like abusing, that they're addicted to, that's going to land them in the hospital. Like it just doesn't happen. I mean, if you don't take too much of it, right, you're going to get a headache and like feel like crap.
I'm just thinking out loud too, like a lot of these younger kids, obviously, they're not on, generally speaking, they're not on as many medications. So you don't even have to check for like the interactions. Like, unfortunately with some people, you gotta, with like the nitrates and stuff like that, with heart patients, you gotta be a little bit careful. But like, no one who's 18 years old is taking nitro, or I've never really seen an 18-year-old on it before. So,
but you should ask about recreational drug use, right? Because if they're using like poppers or something like that, I believe would interact, right? So they need to make sure not to use certain things like that, like poppers. But
yeah,
but
poppers,
yeah,
when poppers it's my understanding is THC and tobacco combined in a bong, and then is that what you're referring to as poppers?
No, I'm talking about like it's kind of like a sex drug. Like it's used a lot in like the gay community. It's like usually it helps you like relax your anus. This is like going.
Okay.
I've never used one. Oh yeah, okay. Yeah.
Okay.
But that
in the cannabis world, I'm pretty sure it's when people take tobacco and cannabis and put it in a bong and then smoke it out of a bong. So you get like this massive rush from cannabis, but then you also get this massive depends on how much you put in, but people could put in like half a cigarette in one thing, and then so you get this like gigantic like rush. I think it's really dangerous. Like I've never even seen someone do it in my life. Like we used to roll like in like tobacco with weed all the time. We were like kids in Newfoundland. It was always like a thing that people did, but I never saw someone do it out of a bong. But what were you going to say? Go ahead.
Oh yeah. So what I'm looking up, and this is like, I probably should know more about poppers, like the ones I was talking about, but alkyl nitrite, and they're basically vasodilators, right? So same like Viagra, Cialis are vasodilators, things that dilate your blood vessels. So if you're taking the two together, you can actually have an unsafe drop in blood pressure, like as if you were taking heart medication. So that's like the only type of party drug that I know of that like, and maybe I'm missing out on stuff because I'm definitely not an expert on like, but yeah.
Yeah, no, you definitely taught me something there. And also too, just so people know, I'm not advocating to use tobacco or cannabis at a young age in any way, shape or form. And again, I'm just saying, just talking about experience. I'm not, advocating for that in any way.
Oh yeah. I think all of these things are like, we're not here to.
Yeah, no, I just said it just to protect myself because I said it, not you. So I just want to make sure I clean that up.
And again, I'm not also promoting poppers. I'm just like, again, as physicians, it's important when somebody comes in front of you to be non-judgmental and to ask about what they do so you can provide them safe information and be like, if you are using this, like I really can't give you Viagra or Cialis because it's not safe, right? Yeah. And if you're not going to use it, then fine. But it wouldn't be safe to combine those two things, for sure.
Yeah. Overall, it's very, very safe, and I mean, it's definitely one of the drugs that people are certainly happiest with, and like I said, effective overall. But in addition, so Cialis is pretty interesting because it has a lot of other medicinal applications. I think, you can correct me on this obviously, but I think the biggest and most popular one now is BPH, or benign prostatic hyperplasia. So that causes people to pee at night a lot. And so I've even seen that now in combination drugs, I believe, with other medicines. So like alpha-1 blockers maybe, or something else, or some other combination of another drug. So like this is legitimately now like, a very good treatment for BPH. Is that correct?
Yeah. So there are official clinical trials that were done by the makers of Cialis that got formal approval by the Food and Drug Administration in the US for an indication of benign prostatic hyperplasia, right? It's type symptoms. So, men like straining to urinate, going frequently, taking a long time to empty their bladder, those type of symptoms, there is actually a formal approved indication for that. So it is not even off label to use it for that. So that is why, there can be like these combination drugs, as long as they're all approved for those BPH symptoms, and they do these combination drugs. I think it's amazing for that. And to be honest, giving a low dose daily Cialis is my first line choice for men with enlarged prostate type symptoms because it is a sex friendly drug, right? So alpha blockers, right? So people might have think of like medications like tamsulosin, or Flomax is like a brand name. Again, I don't know in Canada if it's different, the name.
No, those are the same ones that we use a lot of, most of the time. Yeah.
And those medications, one can cause retrograde ejaculation, right? So like you orgasm and nothing comes out. It can also cause reduced orgasm intensity. So you don't feel like you don't feel as good when you have an orgasm, right? So, and then they also can make people feel kind of like low energy and kind of crappy, right? So they're great drugs if you really need them, but they're not the most sex friendly drugs. And because of that, I'm like, why not just try the daily Cialis? We know from clinical studies it works for these symptoms, and it's a sex friendly drug, right? And if you don't have any erectile dysfunction, that's great. It's not going to hurt you. But if you do, 2 for 1, right? Why not just
use 2.5, 5, 10? What's the dose that you generally use?
I almost always just start them at 5.
5, yeah.
Yeah, it's very, very uncommon that I use the 2.5. But I mean, if somebody's like really hesitant, or they say, hey, I have like a lot of bad reactions to drugs, then we can try the 2.5. But usually I just start at the 5. Yeah. And then 10 and 20 are results. Oh yeah, there are people who are just very, very happy with it. Yeah.
like, I think that when I had Kyle on here, I'm not sure if you'll agree with this or not, but he said that generally speaking, he finds that there's about a 50% reduction in nocturia at night. So he felt like if you're going 4 times at night and you start taking Cialis, probably knock it down to 2 times. If you're taking it, if you're peeing twice at night, you start taking Cialis, it'll probably knock it down to once. Is that sort of roughly what people should expect if they do start taking Cialis for nocturia or for peeing too much at night?
Yeah, that's a great question. I can't say that I've noticed that specific ratio. That may be the case. I can't confirm or refute that. I do think in general, when you're talking about things like getting up at night to pee, it's always really important to talk to the patient about like, what are their goals? Because it's very unlikely that any medication is going to make things perfect, right? It's very unlikely that any medication is going to make you pee the way you did when you were 18 years old and you can sleep for 10 hours. So
Yeah.
what is the reasonable goal? Because, there are people who are like, we have them one, two, 3 different drugs and they want a procedure, then they blah, blah, blah. And I'm like, every single one of these things has diminishing returns as you add them up. And there's more side effects, right? And that's not to say, that all of this also has to depend on personal anatomy, somebody's size of their prostate, et cetera, right? If somebody has like an absolutely humongous prostate, like let's say what we call 200 grams in size, and a very specific conformation that's obstructive, they might just need a procedure, right? And that's, you got to go to a urologist and see. But for like the average dude where they don't have maybe so much of a blockage, you're always going towards better, not perfect. Anything in the human body, right? Yeah.
Yeah. Yeah, for sure. You can't expect like miracles, but like we said, usually they are, fairly effective overall. And even just reducing 50%, going from like, I usually just pee once a night, so it's not too bad. Hopefully I don't get to 2 at, anytime soon. But like for someone who gets up, 2 to 3 times a night, cutting back even just once, I think, would enhance their quality of sleep pretty significantly. And, as we know, sleep is, linked to everything. We can talk about that all day,
Everything. Totally.
So maybe just one last question on the Cialis. So if someone is failing on Cialis, say 20 milligrams, the max dose, that's the max dose I've ever used. Is that the max dose? That's
basically the max dose. Yeah.
Okay. Do you ever add any supplements, something like citrulline malate? Sometimes this floats around on social media. I've seen people talk about it before. Have you ever had any success stories by adding something like that?
Yeah. So the ones that you typically think of that have the best data for them would be like L-arginine, L-arginine, so okay. L-citrulline gets converted into L-arginine by the body. They're both donors of something called nitric oxide, which helps dilate blood vessels, right? Again, for the listeners. So they kind of like potentiate or amplify the action of the Cialis, for example. There's definitely efficacy in the studies and they're relatively safe. The important thing to know is that you have to usually take quite a bit of them. Like I think, let's say if you're doing L-arginine, you're going to be taking like 3 grams a day or something like that, which for a supplement is quite a bit, right? And they can have side effects. People can have like headaches and flushing and like just feel kind of crappy. So you can definitely add them, but there's going to be some overlap in the side effects that you get between the PDE5 inhibitors like Cialis and the L-arginine or L-citrulline because they're all amplifying that nitric oxide. And that all leads to the same things of blood vessel dilation, right? So you can definitely do that. That's the best, I'd say the best supplement. There are other things you can do, right? Like, so I'm a big fan of cock rings. I think doctors don't talk about cock rings enough, but if I don't
really know much about them at all. Like literally like nothing. I can't even remember the last time I heard the word cock ring. Like it might have been Dr. Sue or whatever, like 20 years ago. Like I'd never hear that word. So maybe tell us like it seems like it's something that's like effective that could be, help a lot of men. So how can cock rings help men?
Yeah, well, right. The main thing with an erection that gets you hard is not the blood flow into the penis. It's keeping the blood in the penis once it's there, right? So it's like you have this, like when you have a very healthy penis, the blood gets into the penis and the penis has this mechanism of trapping the blood, and that makes you hard. And when you have erectile dysfunction, usually you basically have some leakage of that blood out of the penis when you're trying to stay erect. And so what a cock ring does is it helps you keep that blood in your penis, right? I mean, that is the main way it works. There's so many devices on the market. There's a gazillion different types. I mean, there are ones that go around the testicles and around the base of the penis, right? Those to me are the best kind because they kind of stay in place the best. But everybody has their own unique anatomy, their own, like some people, you know, have a lot of pubic hair. So maybe they have to be cognizant of that when they pick the right cock ring. But people think of them as just like sex toys, but these can be enhancement devices or really devices that help them with erectile dysfunction, right? So it's like
things that could prevent people from being put on medication potentially.
Potentially, yeah, for sure.
Or maybe like reduce the dose. Like maybe you only need 5 milligrams of Cialis instead of 10 milligrams of Cialis if you have the cock ring with you, something like that.
Totally. And there are things I would say to people, like one, you know, if you're in a heterosexual relationship, like so many guys don't want to try this because they think of it as a weakness. But there are so many women who use vibrators, right? Like sex toys are normal, and like you and your partner, like the important thing is communication, you know, the intimacy, like the chemistry. Like it's not like if you can put on a cock ring and have the best sex of your life, like that's not a weakness, right? It's not like an emasculation. Like just think of it as something that helps you get where you want to go, right? Like, yeah.
Like I take creatine before I work out because I think it helps give me an extra rep, or, you know, it helps me recover a bit. And plus creatine has a shitload of other good benefits as well. You know, I don't care about people, you know, knowing that I take it. Like it doesn't bother me at all. Like I think everyone should take it. I'm actually trying to get my parents to take it now, but it hasn't been going so well. Hopefully they will.
Yeah, I know a lot of women who advocate for women who are like menopausal to like take creatine before they work out because like there's a lot of bone density loss associated with muscle mass loss and everything. It's like you get older, women get older. And I know this big menopause advocate who's like telling all the women to take creatine, which is great because like typically, right, when you were like younger, you thought creatine and you thought of like gym bros or whatever. But yeah, it's really benign. Like why not just do the thing that gets you the outcome that you want as long as it's like safe, right? So cock rings are super safe. Now, my only thing there is like don't buy metal ones. That is where people get into trouble and need like the fire department to cut their cock ring off. Like don't buy metal ones. Like don't. I have seen badness. Don't just never. Even if they look cool, do not put anything metal around your penis, please. Like never.
Okay. So since we're on the topic of cock rings, though, I think we should now talk about penis enhancers or if they do exist. So I know, and I got to ask you about that other guy that I sent you to. I don't know if you clicked on that link that I sent you with the guy doing the surgeries in Mexico. That was hilarious, but also something I want to ask you about. So are there like when men come in and say, you know, I don't feel like, you know, my penis is big enough and I need a bigger penis, what do you say to them, and what devices or what things do you recommend? Yeah,
sure. So I could talk about this forever. A few things, right? I don't like this is probably
why most people are listening to this podcast. They're going to skip ahead to this part.
Yeah, so, right. But this is why being a urologist is awesome because you get to talk about like penis enhancement. That's like your academic career or whatever. Like that's awesome. Okay, so a few things, right? We know from the literature very conclusively that the vast majority of people who feel like their penis isn't big enough have a statistically normal sized penis. Like the vast majority, right? So the first thing is
statistically normal.
Oh gosh, I can't I don't even recall what the exact thing was offhand. Okay. But so I'll even do something as silly as be like, okay, let's like literally measure your penis and then look at, you know, the bell-shaped distribution of like penis size and show you that like you have to like a perfectly average penis, you know? So again, that's not to diminish their feeling about their penis, but to try to help them gain some perspective, because it might be that the only times they're seeing other erections is in pornography, right? Like when you're going around, like, fine, maybe you see some dicks like in the men's room or whatever. People are erect when they're like peeing in the urinals, or hopefully not. But like, so you're not seeing, like, it's hard to compare that, right? So
I played a lot of hockey. I've never seen an erect penis in a hockey dressing room ever.
Exactly. So probably they're comparing their erection to like some really unrealistic standards, right? So this is like the first thing. Then we talk about things that are really benign that you can do, right? So for example, weight loss is going to make your penis look bigger. So there are guys who are unhappy with the way their penis looks, and they've got some, fat in the area around their penis. And if they lose that weight, you're going to see more of their penis, right? So again, it's not like, it's thinking about, how do I enhance the visual of that, right? You can also shave your pubic hair, right? That's not for everybody, but you can shave that. And for some people that like enhances the visualization of their penis, right? Their penis looks bigger. There's other non-invasive things you can do, right? So traction devices are a non-invasive thing, non-prescription. There's one I usually recommend. It's kind of expensive, but it was developed by a bunch of urologists at like Mayo Clinic, who are highly respected. It's called Restore X. And they have pretty good data showing like, if you put this, it's basically like, you think of a medieval torture rack, but like for your penis, but obviously it's not torture, but like, something like, it literally just stretches your penis. Like that's what it does. Right. And
so it makes it longer, but not fatter. Not fatter,
but there's actual data and actual studies that like, if you want to make your penis longer, you can straight up stretch your way into a little bit of extra length. It's not going to be dramatic.
How much?
I mean, you're talking about a few millimeters, right? It's not like,
is that so not an inch?
No, I mean, there's probably nothing that's going to make your penis like an inch longer. I mean, again, the most effective way is if you have extra weight to lose that weight, right? Because there are definitely people who have an inch or more of fat sitting right around their penis. And like, you want to show your package off, like, prep the area, right? I mean, that's like, and not to be dismissive, but really to be like, how do you get how do you feel positive about your penis, right?
For sure.
And usually that's the lowest hanging fruit. And then, I mean, there's definitely more.
But always shave down. Don't shave against the grain when you're shaving your pubes, because if you shave against the grain, you're not going to have a good time or a good look.
And if you have diabetes, don't shave, because people who shave their pubes and they have, or at least diabetes with like a high blood sugar, right? That's where you can get really dangerous infections. So like, I don't want to gross everyone here out, but something like if necrotizing fasciitis or Fournier's gangrene almost always happens in diabetic guys. And a lot of times when they shave their.
So does that mean then that we have pubic hair for, like protecting against like infection? Like, why do we have pubic hair?
I have no idea why we have pubic hair. But I literally have no idea. But the issue that happens is that guys will like shave their scrotum and they'll nick the skin. And if they have diabetes, they have like poor, immune defense, and they have a high sugar environment in their tissues, and bacteria start eating their scrotum. Is basically what happens. So like,
that doesn't sound good.
Yeah, it's really bad. It's like a really bad, like you can get flesh eating bacteria in your scrotum if you're not careful about the way you shave your balls. So
wow,
be careful.
That's scary. So we got the Restore.
Okay. Restore X.
We got the Restore X that can lengthen it. What do we have for girth?
Right. So, I mean, that you can try, like if you have scarring of your penis, something called Peyronie's disease, sometimes using something like a Restore X or even a vacuum device can actually help with the girth. But the most common way that like your average Joe can get extra girth, if he doesn't have scarring of the penis, right? If he doesn't have something called Peyronie's disease, is probably like fillers, right? Like hyaluronic acid, the way people get fillers in their lips. you can have that done in the penis. It's like very safe, right? Because it dissolves.
And so how much have you, and you do this procedure yourself?
I personally haven't done it. I wouldn't be opposed to it. I mean, I think all urologists are like well trained to do it. It's a pretty easy procedure, but I do know urologists who do it.
So how much girth do they give them, and how long does it last?
Yeah, I mean, I think it depends just on how, and this is, again, if you want to interview any urologists who do it, let me know if I can try to put you in touch with them. Like, I have a friend here in Los Angeles who does it. But, it's just going to depend on how many vials of filler you use. The same way, you can have somebody doing very natural looking lip filler, and then you can have somebody who has like the duck lips. You could have like do a ton of penile filler, but you want to think of like, be strategic, right? I mean, if you have like, if you do
you can
much,
make it look really, really awkward especially if you don't have a long penis to begin with, and then you just inject it a shitload of filler, it would probably be like fatter than it is longer, and it'd be like a square.
In the same way you can have
right?
bad filler done on your face, you can have bad penis filler. And like, what you want is like a natural, subtly enhanced effect, right? If you want it at all. I'm not somebody who like doesn't think people need to do this. But if it's important,
but like, how safe is this? Like, it sounds insane to someone to like inject something in your penis. Like, that just sounds like I just can't see very many guys being comfortable with like a needle near their penis. But it is very safe, hey? Like, that's what you're saying?
It's very, very safe. It's very safe. I mean, I think you should have somebody who's like either a urologist or maybe like a plastic surgeon do it. I mean, in my opinion, you should probably have a urologist do it, because like, we in our training do a ton of penis surgery and penis procedures, and like, we are penis experts. But my opinion is, don't go to like your average Joe who's like, in a strip mall somewhere saying he does an aesthetics practice, and like have them start injecting stuff into your penis. Like, ask about how often they do it, ask about their training, make sure, their sterility procedures are important so you don't get an infection. But if you're going to the right person, it's going to be very safe. What's less safe, right, is like when you talk about people getting these permanent implants, right? So there are some permanent silicone implants, right? Like the hyaluronic acid filler dissolves, right? And it's very safe. But you do
have to go back then, right? Like every 6 to 12 months or something, or? It
is something where you have to go back. But then the good thing is that if you overdo it or you're unhappy, you're not locked into that forever, right? And so what I've seen is like, I have seen on the other end, people who go and try to get these permanent girth enhancement surgeries, right? With like a permanent silicone implant, and maybe their body rejects it and they have scarring or they get an infection. And I've seen people with, completely scarred penises. They had to get the device explanted. They have scarring. They can't even like get an erection without pain because the tissue's so scarred. It's like, it looks like a burn victim. I mean, it's like really scary stuff. Now, that's not to say there can't ever be permanent girth enhancement surgeries that are done well. I like know a friend who's developing I have a friend who's developing his own permanent implant device. He's an excellent penis surgeon, but I see way more complications with that. And it's definitely something to be really, really cautious about doing that. Yeah. And the other thing to remember is like, this is like, there's so many nerves on your penis and they're really sensitive, and like, you can really mess things up, right? Like, anyway. Yeah.
So anything else we kind of left out in the penis enhancement, or do you think we kind of covered most things off?
I think we covered most of it. Yeah, I'm just
anything that would cause it. Is there anything that would cause it to shrink in any way? Like, obviously vasoconstriction is just vasoconstriction, but like if people are on like stimulants long term, or like smoke a lot of cigarettes, nicotine, like is there any evidence at all that, being on stimulants or being on vasoconstrictors could, reduce the size, or maybe just potentially reduce the blood flow? Or
Yeah, I mean, I don't know, at least like for things like prescription stimulants, like Adderall, like I don't know of any ill effects on the penis at all. Definitely smoking is associated with increased rates of erectile dysfunction and penile scarring, and scarring of the penis, right, or what we call Peyronie's disease, scarring of the internal tissues of the penis definitely causes shrinkage of the penis. So yes, I mean, categorically, and when I say smoking, I mean like tobacco, cigarette smoke, right? Like categorically, tobacco smoke is bad for your penis. It's bad for your sex life. It's bad for your penis. It can make your penis shrink. Don't do that.
What do you mean by make your penis shrink? Like
scarring of your penis can lead to shrinkage for sure. I mean, like not
okay.
like, diminutive, but like reduction in size. Anything that causes erectile dysfunction, right? So like there's this thinking, even if you're not sexually active, you don't have a partner, even if you're not masturbating, if you have a healthy penis, you're getting erections in the REM phase of sleep. Okay, you're getting nocturnal erections, and that's good for your penis. It keeps it healthy, prevents scarring. If you have really profound erections,
sorry, just not to interrupt. I heard the other day, I'm not sure if this is true, that you can actually buy devices now online that measure penile tumescence. Just because you mentioned it, like, is that true?
That is true.
Okay.
In fact, and I should disclose this, like I have a financial relationship, so I do medical advising for a company that makes a smart cock ring that you can wear overnight that can tell you like how many erections you get while you sleep and how long they last.
You can tell us about that. Feel free if you want.
Yeah. It's called Firm Tech. The website is myfirmtech.com, like MYFIRM tech, TECH. I'm like not good at spelling. Myfirmtech.com. And it's like a really cool device. I mean, it's a cock ring and like it has a pressure sensor and gauge in it, and like it's cool because, people talk about like wearable technology, quantifying all these aspects of your health, knowing your heart rate, knowing your blood pressure, knowing how much you sleep.
It's my Oura ring. Right
yeah,
here.
You got an Oura ring. Yeah. There you go. And a huge independent biomarker is basically your nocturnal erections, right? And we know that is going to give you your nocturnal erection is going to give you a really pure reflection of your penile health, because unlike erections you have with partnered sex, where there's like more factors, right? There's performance anxiety, there's relationship issues, there's all these things that can factor in. Like your nighttime erections, you're either going to get them, they're going to be good, or they're not. And it doesn't have to do with your partner or performance anxiety or how sexy you felt or whatever, right? And so you're going to have a reflection of like, is my sleep quality good? Is my penis healthy? Are my blood vessels healthy? Are my hormones normal? And diminished nocturnal erections are like a huge early marker for things like cardiovascular disease, and, a harbinger of your overall health. So yeah, these things exist. I mean, there are other ones like that guy, like who's trying to live forever, Brian Johnson or whatever.
Brian Johnson.
Like, yeah. He has a different brand. So there are different brands. I don't know how many, but
cool. No, I didn't know this. So this is awesome. I mean, if it's new to me, it's probably new to a lot of people listening too. But I do like agree with you. Like people, I'm sure are laughing. Like, why would you want to like measure like your penile girth at night or whatever? But it's like it does have a reflection on your other health, and particularly like for me, like there's some like heart disease in my family, so that's sort of the thing that I really try to like prevent like the most, like, try to get my fiber, exercise like crazy, like do all the things to try to like really focus on like cardiovascular, prevention. So if you're someone who's like really focused on like cardiovascular prevention, and we should be, because, almost 1 out of 2 of us are going to die from it,
right,
from heart disease, then, having more tools, adding more tools to the toolkit sounds great. So, I imagine your company will do well. I hope you guys do awesome with it. And I imagine it'll probably, show some more studies about like, hey, like if you see like, less erections, like go get like your lipids checked, like go get your A1C checked, like get all this stuff checked, because, it could be, a serious underlying cardiac issue.
100%. So we know that there's tons of data on this, that erectile dysfunction, and I'm not talking the performance anxiety type, but the erectile dysfunction, like loss of nighttime erections, that precedes symptomatic cardiovascular disease like heart attack, stroke by 2 to 5 years, meaning your penis is going to have reduced blood flow before your heart or your brain get reduced blood flow, right? So this is like a huge, huge marker of your health that's dynamic. That's an early warning sign that is totally under leveraged, right? Completely under leveraged.
Super under leveraged.
Super.
And like it seems, and like it should be, people should just look at it like objectively instead of looking at, like, people probably think it's hilarious. And like, yeah, I totally get it. I see the hilariousness in it too. You're measuring your penis at night while you sleep. But like, try to also think like, hey, there's a urologist on here saying that like 2 to 5 years before you may experience heart disease, which is the most likely thing to kill most people, could potentially, show you that you could, make some earlier interventions because you're having this method that's showing you that's predicting heart disease earlier, right? 2 to 5 years earlier. So, I think it's totally legit as a medical prevention.
And like, you can't, as a layperson, right? You can't go out there and just order yourself that, calcium score CT scan of your heart. You can't go and just order yourself like the ApoB, the LP(a), like all these specialized tests. But you can put on a cock ring overnight and monitor your erections. And if you have that loss of erections, you can go to your doctor and be like, I have a legitimate early warning sign of cardiovascular disease. I would like to get these screening tests done, these additional tests. Right? Like, and make that case for yourself. Yeah, adds more
validity to your case when you're asking for tests.
Yeah, exactly. Yeah. Like, and there's a very legitimate reason to do that, So I'm a huge advocate of that. So I'm so happy you asked that question because it's a real thing. And I just want to normalize talking about, sex and the penis and the clitoris and all this stuff in like a non-stigmatized way so people can link it to the rest of their body and improve their like health and longevity and all this stuff and stop thinking that it's like separate from everything else.
No, it's definitely part, like your sexual health, your erectile health, if we're calling it erectile health, is totally linked to your, vascular health, your heart health. And again, like that's, the thing that's most likely is going to kill you for most people is heart disease. That's the number one killer in North America, more than cancer, more than anything. So, pay attention to it for sure.
One last point about this, right? Like one of our lead engineers, really smart guy, he's like been wearing it overnight, like chested out. And just like he notices, for example, if he does intense cardiovascular exercise, right? He has longer, better nighttime erections. Like he sees a real-time correlation in lifestyle choices, in like the quality of food he eats, the type of exercise he does, and like his nighttime erection. It's amazing. So it's actually not only a biomarker to say like get screened for cardiovascular disease, but to say like, how can I see a real reflection of my cardiovascular health in like real time based on the lifestyle decisions I'm making, on like how hard I work out, like what type of food I'm eating, like when I go to bed, like whatever. And he's like actually sees it in this quantified way. Like, oh, I went to the gym today. My erections were better. Like that's kind of cool. Like, right?
It's awesome. It's like an Oura ring for your penis.
Yes. And that's like the one thing that like the Oura ring's not measuring at this point is like your penis, right? Like, and the penis is really smart. Like it takes tons of information about our hormones and our like blood pressure and our inflammation. And it like gathers this all and reflects it in how it functions because it's a dynamic organ. Like, and we just don't give it enough credit for like telling us about our body. So yeah.
You definitely picked the right specialty because you are so passionate about the penis. It's crazy. I love it.
Thanks. And I'm passionate about the clitoris and all things female sexual health as well. But yeah, it's just awesome. Like, it's just fun to talk about. It's just like, I don't know. I mean, I know there are doctors who go into like the eyeball, but like, ugh.
No, I'm gonna have to have you back on because we won't have enough time to get into female stuff today. But
Yeah.
I do have one question that I do want to ask you about before I let you go. So the CAG, this is kind of
Oh,
totally a segue to
no, you
what
had
we were
so
talking
many
about
good
earlier.
questions. Yeah. Yeah.
But the CAG repeat. So like androgen insensitivity, like is this something you can explain? And like, do you ever get people to order the CAG repeat test and explain maybe just a little bit about, when and why somebody would order this test?
Yeah. So to explain to people listening, right, you have something called your androgen receptor, which is you have testosterone floats around your bloodstream. And when it wants to actually do something to your body, like grow a muscle or, help your penis grow or give you chest hair or whatever it is, like these, what we call kind of typical testosterone type effects in the body, will give you energy or make your brain feel like it's on right, that we talked about before, right? It's not just the testosterone molecule that does that directly. It's that the testosterone molecule goes and it floats and it connects with this androgen receptor. And that translates the effects of the testosterone in your cell, right? So it's really important to understand that some people have an androgen receptor that is more sensitive, meaning if they have a testosterone level of 300, they're going to feel totally fine because they have because their androgen receptor is very sensitive. And so they get a lot of bang for their buck when it comes to their testosterone that's floating around, right? And then there's somebody else who has a less sensitive androgen receptor. And if their testosterone level is 300 and they have a very insensitive androgen receptor, they might feel like shit. And maybe they have erectile dysfunction, low energy, and they're not seeing the gains at the gym or whatever, right? And that's because their androgen, the same amount of testosterone floating around in their body is not producing the same biologic effect as a person who has a more sensitive androgen receptor. And we know for a fact that part of the genetic code for your androgen receptor, called this like CAG repeat, right, modifies the sensitivity of this androgen receptor. So people who have more of these CAG repeats have a less sensitive androgen receptor. I don't typically order the test. I mean, maybe there are people who do it. I'm not opposed to it. It hasn't been part of my practice. Part of my practice is to say, like, if somebody has symptoms of low testosterone and they have a borderline testosterone, to believe them, right? Give them treatment until they feel better. And I think that the way to interpret this is to say, like, it's not one size fits all. It's not like a given testosterone level is going to feel normal for all people, right? Now, of course, if you have a testosterone that's like 1,000, I mean, there's not too much we're going to do with the information on how sensitive your androgen receptor is, right? But we're talking about like at the lower end of the spectrum to say, like, maybe this level isn't good enough for you because of your body. And I don't necessarily need to like check it because it's not necessarily going to change the way I manage you. I'm going to manage you to make you feel better. So that's my personal opinion, my personal practice. Again, I just don't know enough about utilizing it in a clinical care context, that test. But, I'd be very interested to know more about the people who are. Yeah.
And is there any way to increase the sensitivity of your androgen receptors? I've heard a little bit about acetyl L-carnitine, although, the evidence seems to be a little bit mixed. And unfortunately, that supplement too is not very bioavailable orally. So it seems like you almost have to inject it to get some kind of therapeutic effect. But is there any way we can increase androgen receptor sensitivities at all, or?
Yeah, that's a great question. I mean, I personally, in my practice, don't know of ways to do that. I think that, you can not only increase testosterone level, but you can increase bioavailable testosterone by making sure somebody's, SHBG is appropriate, for example, and looking at other factors that can influence your bioavailable testosterone and making sure to follow that when you're giving people testosterone. And optimize that. So no, I mean, I think again, you're really focused on giving them an effective dosing regimen of testosterone and monitoring their labs and monitoring their symptoms and getting them to a point where they feel good. I mean, of course, there's going to be people who have like a clinical androgen insensitivity, right? But that's a whole different topic, like a androgen insensitivity that leads to like, indeterminate genitalia or something. But that's like, that's very, very different end of the spectrum, right? And sometimes you can tell a little bit like people's androgen receptor kind of from like how hairy they are and stuff like this. Like there's sometimes some indications of that, right? Like, yeah, but it's not.
Is there any way to lower SHBG? And for people who don't know what we're talking about, a sex hormone binding globulin, and what happens is that can bind to testosterone, and you have a super high SHBG, then your testosterone gets bound and you don't have much free. So, if you want to increase your testosterone, one way you can do is lower your SHBG. I've heard that boron can be effective. I think it's like one study where I saw, but in humans anyway. But is there any other methods to decrease it?
Yeah, this is a great question. So I need, again, I don't know a ton of strategies. I know, for example, some of the newer oral agents of testosterone, like testosterone undecanoate, these really lower SHBG pretty profoundly. I don't know if it's they can be expensive and you have to take them usually like twice a day. They're very cool drugs, but it might be something even where somebody, if they're doing like injectable testosterone, maybe they could even mix it with like an oral, do a lower dose of their injectable and then take an oral. Maybe that's some way to drive down the SHBG. It's like a great question, and something I haven't.
And when I've looked online, I haven't found too much, unfortunately, because which kind of sucks, because some people do have that issue, and I feel like we do need better tools for that, because like I said, the only thing I found was acetyl-L-carnitine, and again, like I'm not like saying that that's going to make the difference for you out there. Like there's just some like preliminary evidence indicating. So I know I only have you for.
Oh yeah, just real quickly on the women's side, we do know that certain types of birth control raise SHBG, and that actually leads to a lot of sexual dysfunction because it can lower bioavailable testosterone, which is really important for like libido, for example, sex drive, lubrication, things like that. But we can talk about that another time. It's a whole other bag of worms, but that's something like I think very strongly about the SHBG in women, also because when you take certain types of estrogens, like oral estrogens, that really raises SHBG. So, it's something on the women's side to really think about. But men, it's very uncommon that you're taking oral estrogens, so that's not as much of a factor.
Yeah, just randomly saw this the other day. There was this RCT. It might have even been a meta-analysis of RCTs. I think actually it was comparing inositol, berberine, and metformin for PCOS, polycystic ovarian syndrome. And inositol did just as well as metformin and berberine. And I think actually they ended up saying that berberine was sort of like almost their optimal choice because it had the least amount of side effects. But they did say, or they think that the inositol skyrocketed SHBG. And so maybe that's part of the reason why people with PCOS benefit from that. So kind of interesting. But yeah, we'll have to do female stuff another time because we're kind of getting out. Very last question though. How many penises have you seen in your life?
I mean, I haven't kept track, but I mean, it's definitely like thousands at this point, like in person. Yeah. I mean,
and how many penises will you see? I mean, you're still only starting your career.
Well, I mean, I'm 40, so I've been doing urology for like over a decade. But yeah, I mean, the sky's the limit. I don't know. There's a lot of penises to be helped, right? And a lot of vulvas and vaginas and clitorises and scrotums. Yeah. And just there's everybody, sexual health is health. If you're having a problem down there, I'm here for you. So yeah, totally.
Anything else you want to say? Anything else that we left off before I say closing remarks?
No, I mean, if you're in, if if you ever want to see me as a patient, I'm happy if people want to travel from Canada, or you have listeners in the US or wherever, I'm happy to see you as a patient. You can call us. Obviously, the international area code would be 01-202-888-6731. You can also look me up online, Ashley Winter, urologist. You can just look me up. But yeah, I'm happy to see anyone as a patient. And certainly if you live in California, we can also do telehealth. So that's all.
Awesome.
Yeah.
Well, thank you so much again. You shared so much knowledge today. I learned, so much. There's certainly things that even going to change my practice, like you said, about teens and the 5 milligrams. If that happens, I certainly feel more comfortable doing that. So, you've made me a better physician today. So
Awesome.
appreciate that. And again, really answered all the questions that I had on the male side for the most part, and I'd love to have you back on to do the female side. So thank you again for coming on, and thank you so much everyone for listening. And as always, I'll be back again soon.